Well, Channel 3 is your vaccine authority. An FDA advisory committee meets tomorrow to consider approving Pfizer's vaccine for children ages 5 to 11. Joining me now live is Dr. Lucia Benzoni from Hartford Healthcare to answer some of our questions. And these are questions you've been asking us about the kids' vaccine. Doctor, thank you so much for being with us this afternoon.
You're welcome. Thank you for having me.
Here's a big question a lot of people have. What will the side effects be like for my child if they can get the vaccine? Will it be the same as the adult dose?
The side effects from the vaccine will be the same as the adult dose, although we think it will be much less because the dose that children will be getting is 0.1 mLs rather than 0.3 mLs. So the lower dose should cause less side effects for the children.
Here's another question a lot of parents have with 11 and 12-year-olds. So should an 11-year-old get a COVID vaccination if available in November, or wait until December to get the full dose at age 12?
Well, the immunity was really good in 11-year-olds. I would go ahead and get it right when it comes out. Get the 0.1 dose, and then when you turn 12, you would get the 0.3. But go ahead and get it right when you can, immediately. There's a 3-week gap between the two vaccinations anyway.
Okay, thank you, doctor. Okay, so what do you say to parents if they're just afraid to have their children get a COVID vaccine? This is a question that a lot of parents have.
Yes, I would say that there are a lot of parents scared about the side effects, worried about what the long-term effects of this vaccine are. And we have to be very transparent and very honest that we haven't had this vaccine out for very long. It came out in December, so it hasn't even been a whole year. And we don't know long-term side effects. And be transparent, but from what we've seen, the side effects are extremely small. We know the side effects of COVID, of getting COVID. We do know that. We know that it can cause the multi-inflammatory system response in children, and there could be some pretty dire straits from that, pretty dire effects.
Right, and I think a lot of parents are wondering also, some of them are hearing that it's not that serious in children, but as you just mentioned, it certainly can be.
It can be. Why play Russian roulette with your child? If you have a chance to protect your child, why wouldn't you do it?
All right, Dr. Lucia Benzoni, thank you so much for being with us. We really appreciate it.
Thank you for having me.